That's really at the forefront of everybody's mind at the moment. If we've already got a good test, why are we changing? So we know that the current test is really good at picking up one type of cancer of the cervix, but it misses some of the other cell types of cancers. And we know that over 99.7% of cancers of the cervix are the result of persisting HPV DNA infection. So the new test, rather than trying to look at and pick up abnormal changes in the cells, we're taking it one step back, and the new test is going to be looking at the presence or absence of HPV DNA. We know that HPV DNA, most people, HPV DNA infection is acquired through skin-to-skin or mucosal sexual contact. Penetrative sex is not necessarily required to acquire HPV DNA. We know that most women following HPV infection will clear it within 1 to 2 years, but in a small group of women, HPV DNA will persist. And it's the persisting infection that then causes those changes in the cells, and then in some cases, again, if it's persisting, will lead to an invasive cancer. But that's a very slow process. So it does take 5 to 10 years to go from HPV DNA acquisition to persisting infection to abnormal changes. So by testing every 5 years for the presence of HPV DNA, we hope to pick things up before the problem has occurred. And it's a much more sensitive test. So currently the test relies on abnormal cell changes, but by looking for that one step prior to that, we're going to be picking up more women, and it's predicted that hopefully the new test will improve the incidence and mortality rates for cervical cancer by about 24 to 36%. So it's going to be a much more sensitive test. Because we know that HPV infection is a very slow process, we know that it's quite safe to have a 5-year interval, and if a woman has a negative HPV DNA test, we know that the chance of her having any problem for the next 5 years is virtually zero. Women will still require the same type of examination that they currently undergo. So lots of women are coming in excited that it may be the end of the speculum, but it's not. We will still be using the speculum examination to visualise the cervix, and the doctor or nurse will be sampling the cervix in the same way as they do now. And then instead of putting the cells that are collected onto a slide, what will happen is that that sample will be placed into a liquid-based medium and sent to the lab. At the laboratory, a HPV DNA test will then be run on that sample. If a woman is positive for HPV DNA, then the cells in that liquid will also be looked at. If the sample is negative for HPV DNA, then the woman will not require another test for 5 years. It's a much more accurate and a much more sensitive test. So to understand the reason for that, we need to just have a quick understanding of the role of HPV in the development of cancer of the cervix. So HPV, or human papillomavirus, is responsible for over 99.7% of cancers of the cervix. And we know that human papillomavirus usually is acquired. There's about 40 types that can affect the genital tract, and it's acquired from skin-to-skin sexual contact. Penetrative intercourse is not necessarily required, so skin-to-skin and mucosal contact can transmit human papillomavirus. And most women will clear a HPV infection within 1 to 2 years. For those women who have persisting HPV infection, the time to produce changes in cells is in the order of about 5 to 10 years. So it's a very slow process. So you acquire HPV DNA infection, majority of women will clear it, but women who persist with the HPV DNA infection may then go on to develop abnormal changes of the cervix, and that takes many years, over 5 years for that to happen. And then if there is persistence, then you get precancerous changes, then the next step in the process is invasive cancer, and that takes even longer again. So by testing for the human papillomavirus, we know that if the test is negative, then the chance of having any abnormal cells develop in the next 5 years is virtually zero. If the test is positive, well then the next step, the next part of that test is that the cells are looked at to ensure that they are, if there's any changes there. So this test, in a nutshell, is really looking at the earliest step in the process. So rather than needing abnormal cells present to detect the abnormality, we're looking for that initial step in the process. So it's a very sensitive test, meaning that if the test is negative, the chance of there being a problem in the next 5 years is virtually zero. Currently, the screening program targets women aged between 20 and 69. The new screening target group will be between 25 and an exit test occurring sometime before 74. That starting age is being shifted from 20 to 25, and there's really good reasoning behind that. So, cervical cancer in the under 25 age group is quite rare. So the current incidence is about 1.7 per 100,000 women. So we're talking about really, really low numbers in the under 25 age group. And we know with over 20 years of data from the current screening program that the current Pap test has not changed the numbers in the 20 to 24 year age group. So the current test that we're offering those younger women isn't changing the rates of cervical cancer. So for those reasons, and when we understand the natural course of HPV DNA, we know that it is quite safe to start that test at 25, because when we think back to the natural course of HPV, it's those persistent infections that we want to detect, and we know that by screening the under 25s, we're not making any impact. The important thing to remember though is that regardless of age, if a woman has symptoms, she should be seeing her doctor and having testing performed in a non-screening test. Any sort of bleeding symptoms, so bleeding after sex, bleeding in between periods, those are the symptoms that should prompt a woman, regardless of age or regardless of when her last screening test was, to see her doctor, because then the doctor would perform a HPV DNA and liquid-based cytology co-test regardless of age, to make sure that there wasn't any sinister cause, and that is outside of the screening program. There will be a caveat in the guidelines do allow for consideration of an earlier commencement of screening for a woman between 20 and 24 if there has been early sexual activity. So if a woman commenced sexual activity under the age of 14, for example, if there was childhood sexual abuse or if sexual activity was commenced before HPV vaccination, the new guidelines do allow for consideration of a single screening test between the age of 20 and 24 for those women. Yes, of course. So certainly the vaccination, which was introduced in 2007 in Australia, has made huge inroads to the incidence of HPV, particularly in our younger women. But of course, we still need to be screening everyone regardless of vaccination status. So from now until the 1st of December, it is business as usual. We should be following the current guidelines and offering screening as per the current guidelines. So if a woman between the age of 20 and 25 who is eligible for screening under the current the current screening program presents and is eligible and requests screening, she should be offered that. After the 1st of December, then we change to commencing at 25, because keeping in mind that we're not offering the new superior test until the 1st of December. The National Cervical Screening Register will be moving from a state-based register to a national register, and so women will be sent an invitation letter from the register once they are eligible, so age 25 and over will receive those invitation letters. But of course, the woman herself should be aware of her screening needs, and of course, importantly, a woman's doctor should be opportunistically offering that screening for eligible women. So hopefully by, combination of approaches there, that we'll be seeing the right women screened at the right time. Yes, but that's a tricky question to answer. So keeping in mind that human papillomavirus does not require penetrative sex to be transmitted. So it can be transmitted through skin-to-skin contact, through orogenital contact, through digital contact, through sex toys. So when we're taking our sexual history, when women are talking to their doctors about their sexual history, we need to keep in mind what sort of behaviours may put a woman at risk of having been exposed to HPV. And it doesn't necessarily mean penetrative sex. And also, of course, that includes women who are in same-sex relationships. We know that lesbian women are one of our under-screened groups for cervical screening. So it's really important that women are having open conversations with their doctors, and that doctors and nurses are knowing to ask the right questions about sexual history to get a correct understanding of a woman's risk and of her screening needs. Yeah, so the new guidelines quite clearly address this. So most women who have had a hysterectomy will not require ongoing cervical screening. If a woman has had a hysterectomy for benign reasons, so if she's had a fibroid or problem periods that have led to her having a hysterectomy, and at the time of hysterectomy when the sample was sent to the lab, the tissue all looked normal, and she's had a normal history of pap smears in the past, there's no need for ongoing cervical screening or for vault smears for that woman, because obviously she doesn't have a cervix, so the screening test is taken from the vaginal vault. However, there are certain groups of women who will need to have ongoing screening. So it'll be really important that the woman has a discussion with her GP and the gynecologist who performed the hysterectomy as to whether she does have ongoing screening requirements. And the new guidelines do cover that quite nicely, because it depends on a woman's past screening history, it depends on the reason for her hysterectomy, and it depends on what we call the histopathology, or what was found on the hysterectomy sample at the time of hysterectomy. So if there were any abnormalities in that, that will then determine her ongoing screening needs. There really is no need to continue two-yearly screening with the current test because of our understanding of the behaviour and the natural history of HPV. We know that if you've got a negative test, the chance of having a problem in the next 5 years is virtually zero. So for that reason, we wouldn't recommend two-yearly screening to continue for women who are having HPV DNA testing. That said though, there are some groups of women who will require testing every 3 years because of their immune system. So as we discussed earlier, it's our immune system that clears human papillomavirus. But for women who are immunosuppressed, so in women whose immune system may not function as well, they may be at risk of persisting HPV DNA more so than a woman who is immunocompetent or who has a healthy immune system. So again, the guidelines do address this nicely, and it will be a conversation for a woman to have with her doctor based on her individual circumstance. But in general, women with immunosuppression, so that's mainly HIV positive women, solid organ transplant recipients, and some groups of women who are taking medications that may turn off the activity of their immune system, so immunosuppressant medication, will be eligible for 3 yearly screening. And it'll be really important that the woman's doctor is putting that on the request form at the time of her screening test, so that can be followed up properly. 99.7% of cancers of cervix are due to HPV. But you're correct, that's not 100%. I guess though we're talking about such small numbers, so 0.3% of cancers potentially are going to be other cancers that are not HPV related. And when we think about a population-based screening test, is not going to pick up those small numbers. So really it's about coming back to empowering women to understand that if they're having any abnormal symptoms, then they should be seeing their doctor for appropriate testing. But when we've got now a cervical screening test that is going to pick up something that's causing 99.7% of cancers, that is very reassuring. And as I already said, the current test is only really good at picking up that one particular type, those squamous cancer types, whereas we know that the new test is going to be much better at picking up some of the other types that are also due to HPV DNA that the current test is missing. So we're going to be seeing a much improved pickup rate with the new test. So there's going to be, the terminology used is an exit test. So if a woman has a negative HPV DNA test between the age of 70 and 74, she can safely exit screening. If a woman between that age has a positive test, then she will be referred for a colposcopic examination. If a woman chooses and wishes to continue screening beyond the age of 74, then she can request that. But generally the advice will be that if there's a negative test between 70 and 74, a woman can safely exit screening.